Hi, in today's video, we'll break down two high-yield USMLE-style questions. We'll learn how to recognize certain drug toxicity and also we'll explore key ECG changes seen in electrolyte imbalances and how to spot them clinically. A 68-year-old woman presents to her physician with complaints of fatigue, nausea, decreased appetite, and visual disturbances, including seeing yellow-tinted objects. She reports that these symptoms started a few days ago. 1 week ago, she was prescribed furosemide for swelling in her legs. She also mentions that she has been taking a medication for her heart rhythm for several years. On examination, she appears mildly dehydrated and laboratory tests reveal hypokalemia. An electrocardiogram shows atrial tachycardia with slowed AV conduction. Her current symptoms are most likely due to toxicity from which of the following medications? A. Digoxin, B. Milrinone, C. Propranolol, D. Quinidine, E. Verapamil. The correct option here would be A. Digoxin, and that's because this patient's presentation and ECG findings are suggestive of digoxin toxicity, which is triggered by concurrent furosemide use. Now, furosemide can cause hypokalemia, which enhances digoxin's binding to sodium potassium ATPase, increasing toxicity risk. Digoxin toxicity commonly causes atrial tachycardia with AV block due to its dual effect on atrial and nodal tissues. Let's have a look at why the other options are incorrect. Option B is incorrect because milrinone is administered IV and is indicated only for the short-term management of congestive heart failure. It does not interact with furosemide and does not cause the side effect profile described in the question. And option C is incorrect because propranolol also does not interact with furosemide and does not cause the side effects mentioned in this question. Option D is incorrect because quinidine toxicity typically presents with tinnitus, headache, blurred vision, and vertigo, none of which are seen in this patient. And cardiotoxic effects include QRS widening and QT prolongation, which can trigger torsades de pointes. These features make quinidine toxicity unlikely in this clinical scenario. And option E is incorrect because verapamil also does not interact with furosemide and does not cause the side effects mentioned in this question. A 64-year-old man visits his primary care physician due to increasing fatigue, poor appetite, and generalized bone discomfort for the past 3 weeks. He reports difficulty concentrating and has recently noticed that his stools have become infrequent. He has a history of hypertension, currently managed with medication. On examination, he has localized tenderness over the lower back. Vital signs reveal a blood pressure of 158/96 and a pulse of 78. An ECG is obtained and shows a shortened ST segment and QT interval. These ECG findings are most likely due to which of the following electrolyte disturbances? A. Hypercalcemia, B. Hyperkalemia, C. Hypocalcemia, D. Hypokalemia, E. Hypermagnesemia. The correct option here would be A, and that is because given the clinical picture of constipation, back pain, and the above ECG findings, patient most likely has hypercalcemia. Hypercalcemia can cause bone resorption, which can present as pain and constipation. And hypercalcemia results in shortening of the ST segment and QT interval. Let's have a look at why the other options are incorrect. Option B is incorrect because hyperkalemia leads to tall, peaked, narrow T waves. When hyperkalemia is more severe, it may lead to QRS widening, ST elevation, and disappearance of P waves. And option C is incorrect because hypocalcemia is associated with prolongation of the QT interval. Option D is incorrect because hypokalemia leads to flattening of the T waves and appearance of U waves. The QT interval and the QRS duration are often normal. And option E is incorrect because hypermagnesemia can cause ECG changes such as prolonged PR interval, widened QRS complexes, and in severe cases, heart block or cardiac arrest. However, it does not typically cause a shortened QT interval.